On this Tuesday night, the political fight delaying emergency aid to Canadians. The Liberals' plan to pass an emergency bill during this pandemic hits a roadblock.
Hell no.
Plus, the message the Prime Minister cannot stress enough.
Stay home.
President Trump's prediction for when the U.S. economy will be back in business.
I'd love to have it open by Easter.
Critics say it could cost millions of lives. Deepening dangers in the line of duty, the risks our paramedics face, and stuck in a precarious position in Peru.
Every day goes by and we have no information.
Canadians desperate to get home.
Global National with Donna Friesen.
Good evening and thanks for joining us. The middle of a pandemic seems like the worst time for politicians to bicker over how to help Canadians, but it's happening. The federal government has promised to deliver $82 billion in emergency aid, but now that is stalled. An emergency session of Parliament has been suspended. I'll tell you why in just a moment. First, where we're at with this virus. More and more Canadians are getting sick, and this message needs to be repeated.
This is serious. The decisions you make have serious consequences, not just on your community, but on the entire country. If you want things to get back to normal, do your part. Stay home.
Here's why staying home is crucial. Canada's Public Health Agency says 90% of new cases in the last week are linked to community spread. That means people are getting it from someone else in the community. And it's a dramatic shift from a few weeks ago when most reported cases in Canada were the result of overseas travel.
Really, our primary strategy is to ensure people are self-isolating when they should be, and also that everyone is respecting social distancing. If we're going to get a handle on community spread, everybody has to respect those measures.
More than 700 new cases were reported across Canada today. Quebec had the biggest daily spike, 395 new cases today. Ontario, there are now a total of 588 cases, including 31 healthcare workers. In total, across Canada, more than 2,700 people have now tested positive for COVID-19. A small group of MPs went to Ottawa today for an emergency sitting of Parliament. We'd been told they'd all agreed to pass a bill to help Canadians who have lost their jobs or can't buy groceries or pay the bills or have to stay home because they're sick. But it derailed, and Parliament has been suspended while MPs negotiate a way through the impasse. Michael Couteur on politics during a pandemic.
Extraordinary measures for an extraordinary session of Parliament. The Speaker's parade reflecting the physical distancing being asked of all Canadians. But what was being asked of this Parliament was too much, according to some opposition MPs like Scott Reid.
How are you doing?
The Conservative defied his own party's orders to stay away from the House of Commons because he wanted more scrutiny on the government's $82 billion emergency stimulus bill. An early draft would have given sweeping taxation powers to Finance Minister Bill Morneau until the end of the year 2021.
You can imagine how shocked we all were.
A Conservative finance critic, Pierre Poilievre, is in self-isolation, but shared his feelings widely on Twitter.
We said, hell no. We will not grant unanimous consent for such a bill to even come before the House of Commons.
The government took that provision out of the bill, but left in powers for other ministers to spend money to help fight the pandemic. And while the Prime Minister says he respects Parliament's role to oversee spending, he says this situation is unique.
We recognize that this pandemic is moving extremely quickly, and it is an exceptional situation that requires extreme flexibility and rapidity of response by governments to be able to help Canadians.
That flexibility, the government says, would allow it to craft more economic measures to deal with more layoffs, like Tuesday's announcements from Bombardier of more than 1,200 temporary layoffs and WestJet's loss of nearly 7,000 employees.
We are here today to pass the measures that were announced to help people get through the next few days and weeks.
And time is of the essence, not only to help those people, but because this legislation still has to get through the Senate, which is scheduled to deal with this bill in its own special sitting Wednesday morning. Donna,
All right, Michael Couture in Ottawa, thanks. Here's a staggering figure. Almost 1 million Canadians applied for employment insurance just in the past week. That is a record for this country, and it gives you some sense of the urgency for so many Canadians and businesses who need financial help. Mercedes Stephenson is with me from Ottawa. Mercedes, this is the kind of thing that drives people crazy about politicians. But I guess late tonight, there's word there may be some progress.
There may be some hope on the horizon for that $82 billion aid bill to start moving. I'm being told by sources on both sides of the aisle that there is a new draft bill. Now, I'm hearing the opposition has not yet received it, but they have been told by the Liberal government that it is coming. And I'm hearing that it is expected to address some of those sticking points that the NDP and the Conservatives had about the sweeping powers that the Liberals wanted federally for cabinet ministers to have to be able to tax and spend without parliamentary authority or approval. Earlier tonight, we spoke with Conservative leader Andrew Scheer about what the holdup is and why he didn't want to vote for the original Liberal bill. Here's what he told us.
The government is choosing to link the financial measures that we support to a whole other series of proposals changing the way Parliament operates. There's no need for that. We could vote right away on the financial package, get that out the door. That would then allow space and time for parliamentarians to negotiate how we are going to do our job in the weeks ahead.
The NDP and the Liberals, the NDP and the Conservatives wanted to just deal with the economic aid package. That may be happening now with this new draft bill. We'll have to wait and see, Donna, but perhaps the money will start flowing sooner rather than later.
All right, Mercedes Stephenson in Ottawa, thank you. One bright spot today, the prospect of trillions of dollars in government stimulus around the world boosted the stock market. The TSX surged more than 8% today, up 1,000 points at times, after hitting its lowest level since October 2011 yesterday. The Dow Jones jumped 9% today, about 1,800 points, but there's such volatility right now, it's impossible to know what will happen tomorrow. Well, we know there are lots of people who can't work from home and whose jobs potentially put them in direct contact with the virus. Paramedics, for example. As Mike Armstrong explains, this pandemic makes their job more complex and dangerous than ever before.
One of the worst outbreaks of COVID-19 in the country is this retirement home east of Montreal. There have been 4 deaths in this one location. It may also be one of the reasons the local ambulance service is down 17 paramedics. The director of operations says 2 of his paramedics have tested positive, 5 have symptoms and are waiting for tests, and 10 are in self-isolation as a precaution. Between all the extra cleaning and the overtime, the service has been stretched to its limits. The director says right now they can make do, but it's hard and they can't keep losing people. COVID-19 is complicating work for ambulance services right across the country. 2 paramedics in Toronto have tested positive and another in Waterloo, Ontario. It's not an easy job in normal times. Right now, it's even tougher.
There's a 6-foot or 2-meter safety distance.
Montreal paramedics now start every call with an evaluation. They ask the patient whether they've traveled recently. That determines whether they have to wear the full protective gear. But one of the problems paramedics are finding is people aren't always telling the truth.
If you are sick or you think you're sick, please tell us. That's number one.
Quebec's health minister appealed for honesty Monday. It's a matter of life or death, he said, and this isn't the time for lying. Well, on one of the calls to the retirement home, paramedics were in contact with a person who said they hadn't traveled. They later admitted they had, but said they didn't have any symptoms. They did. Mike Armstrong, Global News, Joliette, Quebec.
Community spread is what public health experts fear the most, and it's happening in Canada now. The virus is spreading from person to person in our communities. The thing is, it can't infect people it can't reach, and that's why keeping physically distant from people matters so much right now. Eric Sorensen explains.
Even when we gather, we're keeping apart. The behavioral shift in society has been astounding. With exceptions, an entire population has begun to maintain distance. The urgency made clear by the spike of almost 800 COVID-19 cases reported in Quebec the last 2 days.
I know we're going through difficult times. I know it's stressful.
The Premier telling Quebecers it will be temporary, but only if Canadians carry through with physical distancing. 90% of cases are now linked to community transmission, not international travel, and it's harder to track community transmission.
We've now shut down conferences and mass gatherings, and people are reducing any gatherings of over 50, but in fact going even more stringent than that. We're saying stay home and maintaining a 2-meter distance from others.
It'll require a long period of community-minded separation. Here's the trend in Canada. 1 month ago, there were 11 confirmed cases. We passed 100 confirmed cases on March 11th. We surpassed 500 on the 17th, 1,000 on March 20th, and 2,000 on the 23rd. It suggests new cases are now more than doubling every 4 days. And at that rate, we could see 10,000 cases or more by the end of March, which is just next Tuesday.
The doubling time initially will be 3 days or 4 days, and then it starts to get shorter and shorter as more and more cases happen. And that's what we were seeing in Italy. And our hope is that we can kind of keep that rate as low as we can.
The risk is to all of us of getting the disease and overwhelming our hospitals in this critical period.
But if we're not aggressively implementing social distancing measures, then that's going to be a problem. That is going to be a problem for every hospital in the country.
Francois Legault is blunt about the job in front of us all.
The faster we limit contagion, the faster we'll save lives.
Eric Sorensen, Global News, Toronto.
The 2020 Olympic Games in Tokyo have been postponed. It's the first time the Olympics have been rescheduled because of a pandemic. On a phone call with the International Olympic Committee president, Japan's prime minister agreed to delay the Games. Shinzo Abe says they will happen no later than next summer. And finally, J.R. Shaw, the founder of Shaw Communications, has died. He was a pioneer of Canadian business, a visionary of the telecommunications sector. The Order of Canada recipient, built Shaw Communications and Chorus Entertainment, which owns Global News, into one of Canada's top companies. He was also known for his support for many philanthropic causes. J.R. Shaw was 85 years old. We've been inundated with your questions about COVID-19. Can the virus live on fruits and vegetables, for example? We'll ask the experts coming up. There's a new warning from the World Health Organization. They say the COVID-19 virus is now spreading so quickly that social distancing must absolutely continue, but it won't be enough to completely slow it down. They say countries must be much more aggressive with testing every suspected case and quarantining close contacts in order to flatten the curve. Here's how this pandemic has accelerated. It took 67 days from the first reported case to reach 100,000 cases, another 11 days to reach 200,000, and just 4 days to reach 300,000. Now, 84 days since the first case, there are close to 400,000 cases. It's now clear the U.S. could soon be the next epicenter of this global crisis. The spread of the virus is accelerating there frighteningly fast. There were more than 9,000 new cases confirmed just today. That's the biggest increase of any country. Yet President Donald Trump says he wants to get everyone back to work by April 12th. At least one top public health official says that could lead to millions of deaths. Jackson Prosco reports.
From the sprawling convention center that will soon become a 1,000-bed hospital, New York's governor issued a dire warning.
The rate of cases, the rate of new infections, is doubling about every 3 days.
Medical equipment is already in short supply. A quarter of those hospitalized are in intensive care. Now there are predictions of a tidal wave of cases over the next 3 weeks that will overwhelm the system.
We're not slowing it, and it is accelerating on its own.
But in Washington, President Donald Trump urged a speedy return to normal life.
But you're going to lose more people by putting a country into a massive recession or depression. You're going to lose people.
Just halfway through his own 2-week campaign to slow the spread, Trump now suggests social distancing and business closures aren't worth the economic toll.
I'd love to have it open by Easter.
I think at this time, this is a little bit too early.
Experts have warned lifting restrictions too soon would be disastrous.
If you let it run rampant, at least parts of the health system could get overwhelmed.
That's already the reality in New York.
And we're not going to put a dollar figure on human life.
Where the state has just a fraction of the 30,000 ventilators and 140,000 hospital beds it needs, and where officials are now begging the federal government to order production to meet expected demand. Jackson Prosco, Global News, Washington.
India has taken extreme measures to avert catastrophe. The entire country, 1.3 billion people, have been ordered to stay home for 21 days. Prime Minister Narendra Modi says as of midnight, everyone should forget what going out means, though he says essential things like food and medicine will be available. There are only about 500 confirmed cases in India, but testing has been limited and a spike is expected. And this is Britain under lockdown. Everyone in the country under strict orders to stay home except to get food and do limited exercise. Gatherings of more than 2 people are banned and only essential workers are allowed out. The lockdown is set to be in place for 3 weeks. That's up for review, though. Britain recorded its highest single death toll today, 87 new deaths. Still ahead, the Canadians in Peru waiting to come home. In the past week alone, 1 million Canadians have returned to Canada from abroad, and the Prime Minister has a strong message for them.
If you've just returned from abroad, go straight home from the airport and do not leave for at least 14 days. This is not a suggestion.
Work is underway to repatriate other Canadians who are still stuck abroad. And as Ross Lord reports, in this time of crisis, rescuing everyone right away is proving to be impossible.
Among the throngs of tourists in Peru desperate to return home, there are thousands of Canadians, like this group of high school students from Vancouver College. They came to help build a home for a single mother. Then the COVID-19 outbreak escalated, forcing the government of Peru to close its borders and force everyone into quarantine.
There is a lot of underlying stress, especially when they phone home. You can see that they're just trying to hold it together.
Lillian Vernier is managing her own stress, a medical problem that requires an intravenous procedure every 2 months to keep the condition at bay.
After 2 weeks that I've missed my injection, that could, then my condition will become more problematic. And that 2 weeks comes up on Friday.
Friday is when the last of 3 scheduled Air Canada flights from Peru to Canada is due to leave. Passengers receive a code in advance.
So as soon as we get a code, we need to book our ticket, pay for our ticket, and then hopefully we make it before everybody else.
It's becoming a competition.
We're checking our emails every 5 minutes.
Diego Martinez, his wife Gabriela, and their daughter Margot are torn. They urgently want to return to Toronto rather than risk being infected and at the mercy of Peru's overwhelmed healthcare system. But they're distraught about leaving their hosts, Gabriela's parents.
I don't think my dad, who's suffering of Alzheimer's, would make it. And
if he gets infected.
If he gets infected, God forbid. But yeah, that's a scary thought. If I have to leave, I mean, if I'm called into one of those remaining 2 flights.
The Canadian Embassy says it's working to secure more flights as the emotional effects of the crisis deepen. Ross Lord, Global News.
A frosty reminder on keeping your physical distance. Next. We know the situation in Canada and around the world is getting more serious by the day, and that it can be hard to keep track of all the advice and the directions that are being given from various public health officials. We know you have lots of questions too, so we have put our Jeff Semple on the hunt for some answers. Jeff?
Well, Donna, last week, about 1 million Canadians returned to the country from abroad after being urged by the federal government to get back here ASAP. They, along with many others, are now being ordered to remain in self-isolation. And many viewers are now writing to ask what self-isolation actually means.
The big question is, who is allowed to go for a walk? Who is allowed to go out and get some fresh air? Those of us who are isolating.
The confusion around self-isolating indoors might be due in part to some mixed messages from health officials.
Please, stay home.
Stay home.
The advice we give to every international traveler returning, which is, still stay at home.
while others, including Canada's chief medical officer, are opening the door.
And if you do need to venture out for fresh air, keep your hands away from your face and practice meticulous hand washing.
One viewer wrote, "I'm hoping somebody can be a bit more clear on the self-isolation guidelines."
People are supposed to stay at home. It doesn't mean go out to get groceries. It doesn't mean go to the park. It doesn't mean go for a jog. It means stay at home.
And he says everyone should keep their distance.
But what does a safe distance actually look like? Well, the World Health Organization is asking people to stand at least 1 meter apart. Well, public health officials here in Canada are going even further, asking people to stand at least 2 meters or 6.5 feet from each other.
Depending on the strength of the sneeze and the amount of stuff that you sneeze, it could be 3 feet, a meter.
Canadians are trying to keep their distance, but one place many still need to go is their local grocery store. And that's prompted a lot of viewers to write in to ask this.
My question is the concern I have around unwrapped produce, specifically vegetables and fruit, or is there a way that we can protect ourselves?
If somebody had coughed on the food, there's an off chance there could be something there. This is part of the reason why we suggest, to wash your hands before you eat, and you're going to be washing your produce anyway. That should eliminate that risk.
Another viewer asked how long the crisis is likely to last, or before a vaccine can be mobilized.
The lockdown, the physical distancing measures, I think they're going to be going on for at least 4, if not 6 weeks.
But even the most optimistic official estimates suggest that a vaccine is at least a year down the road, underscoring an uncomfortable message. We've got a long way to go. Donna?
A long way to stay away from each other. Jeff Semple in Toronto, thanks. That is Global National for this Tuesday. I'm Donna Friesen. Just one more reminder to stay home and practice social distancing. And where there's still some snow on the ground, these snowmen are helping to spread the message too. Thanks for watching and take care of yourself.